Mr. Weinstein, what seems to be the problem today?
So tired. My leg hurts really bad.
Any knee surgery lately?
No, actually, my skin is so pale.
And that's normal for you?
Yeah, I guess so. But I'm so tired and I'm dizzy too. This is bad.
Alright, well, just by looking at you, I'm gonna diagnose you with Bloom syndrome. Bloom syndrome is often characterized by those of very short nature and is associated with acute lymphoblastic leukemia.
Does that mean I'm at risk?
It's possible. I'm gonna run some blood tests and we're gonna see what's wrong.
Oh,
But first,
no.
let's figure out what the heck is wrong with Mr. Weinstein here.
So, let's talk about some risk factors for acute lymphoblastic leukemia. One of the main risk factors is Down syndrome, as signified by this down arrow. Next slide, please. Bloom syndrome, which is characterized by short stature, as we mentioned before. Now, I don't have Bloom syndrome, but if I did, I might look something like this. That's a risk factor for acute lymphoblastic leukemia. And one of the main risk factors is just genetic predisposition. Since we don't know the exact cause of acute lymphoblastic leukemia, it's hard to say what's a risk factor and what exactly leads to this disease. So we just know that, as any cancer is, genetic predisposition is one of the main factors. And as mentioned before, we don't know the exact cause, so we have this goofy looking question mark to signify that. So some of the symptoms of acute lymphoblastic leukemia that are going to help you diagnose a patient are, you're going to see tiredness is one of the main ones. This bone pain, which I came in asking about, even though I haven't had any knee surgery as of late. Frequent infections we see over here. We'll talk about some of the causes for these symptoms. That's a main symptom. Easy bruising and bleeding, internal and external bleeding caused by a lack of platelets, and pale skin, which normal for me, not normal for everybody.
Exactly.
We're not here yet. We're going to go right back
To our regularly
scheduled program.
So, Ben, we ran the tests. It appears that your blood cells are extremely immature.
How immature?
You're gonna be as immature as me in a few days if this keeps up.
No!
I know.
Oh.
It's a true shame. And I will have to diagnose you with acute lymphoblastic leukemia.
No.
Your lymphocytes are just lymphoblasts. You have 97%. And I know this sounds confusing to you fellers in the audience there. So let's explain what a blast is.
What is a lymphocyte? So, a lymphocyte is a mature white blood cell, which there's two denominations of them. There's B lymphocytes, which are key in making antibodies for the immune system, and T lymphocytes, which, ironically enough, are key in fighting cancer. Before you have a lymphocyte, you'll have a lymphoblast, which is an immature white blood cell. These lymphoblasts can't function on their own. They're a multipotent stem cell. So when you have these stuck in a cancerous state, cycling in G0, it's going to be really bad for your system because they're not functional, but they're proliferating. We'll talk about the effects that has on your body a little bit later. So to diagnose a lymphoblastic leukemia, one of the main tests is going to be a complete blood count test. That test, they draw some blood and they just analyze the relative amounts of all the different types of blood cells in a certain amount of your blood. So that test, we'll look at some results on the next couple slides, some example results to see what's normal, what would constitute a diagnosis. There's also a spinal tap test, which if somebody has a lymphoblastic leukemia, you can take a spinal tap to get information on the spinal cord and the nervous system to see if this patient has a wildly spreading condition. So, in a diagnosis, you might see, this is a microscopic image of healthy blood cells versus acute lymphoblastic leukemia. Lymphocytic, lymphoblastic are pretty much interchangeable when you're talking about these conditions. So we see healthy blood cells, the purple, which is white blood cells, are few and far between, and they look pretty round and normal. These are large, misshapen, and they are dominant in the sample of blood. As I mentioned before, we have some example results from a complete blood count. We're going to be using these in our doctor-patient scenario as the example. So if you look over here, comparing the normal values to the patient's values are almost all abnormal with the exception of a couple like MCV here, MCH. But something like white blood cells, they have way more than they should. Here we have a differential count, which is just the relative amounts of different types of white blood cells in the blood. Blasts here, which are those immature cells, are 97% of this person's white blood cells. That is more than enough to constitute a cancer diagnosis. Usually 20% is all you need. This person's got 97%. This person's in danger.
Yeah.
So staging for acute lymphoblastic leukemia once you get diagnosed is not like the standard stage 1, stage 2 severity ladder that we're used to. It's either just untreated, you have it, it's not treated yet, in remission, you had it, but now it's treated, or recurrent, you had it, you treated it, and now it's coming back. And the frequency of this diagnosis, leukemia, specifically acute lymphoblastic leukemia, is one of the most common childhood cancers, making up over 25%, which is dominant.
Now back to your regularly scheduled programming, temporarily.
Doc, what now?
Alright, here's how it works. So we ran the tests. I just filled in your height and weight from last year. I feel like I could reasonably assume that you, my vertically challenged friend. And yes, you do have acute lymphoblastic leukemia. Your white blood cells are very immature and they may continue to be as much. You had 97% blasts, and this was actually the first test that I've ever seen you fail.
How can I be so immature?
I don't know, Ben, but soon you're gonna be as immature as me, and I think today you can relate to a lot of Swifties. Because now you got bad blood. Anyway, let's talk about some system changes in the body and see how everything might change. As we can see here, the immature white blood cells are immensely outnumbering the mature white blood cells, which will lead to
red blood cells and platelets as well.
Of course. And they may metastasize across the body. This means that they're going to spread and infect other parts of the body, and since the blood is obviously the natural highway, that could happen. You may also experience some symptoms as we start to administer some medicine to you, which I'm going to get to in a little bit. But for now, you may expect some system changes such as a continuation of the paleness, muscle aching, and fatigue.
And additionally, with these blasts dominating, your white blood cells are nowhere to be seen. They're going to be unable to fight infections. You're going to get sick a lot. And since there's very few platelets being produced because of this overwhelming blast, when you bleed, you're going to bleed a lot because platelets are not going to be able to come there and patch up your blood.
So, my patient, it is important that for now we're going to have you stay inside so you don't get any particular illness, which could prove fatal as a result of the lack of platelets and immune cells. Now, I'm sure you're probably wondering, how the heck is this actually happening to me? What is going on? Well, this is the 12th chromosome and this is the 21st chromosome, and they're not homologous by any means. But via a mutation, the 12th and 21st chromosome are going to translocate and exchange some genetics, specifically the TEL and AML1 genes. Now you may be wondering, I just heard TEL and AML1, I don't know what any of that means. Like, what the heck is going on? Don't worry, I can explain it to you. The TEL gene is the gene that regulates the exchanging of and regulation of information across the body, whereas the AML1 gene regulates the exchanging of blood, transfer, and all kinds of things that keep your blood safe and healthy. When these are translocated and fused, your body is no longer safe. Your body can't exchange and regulate information properly, and it can't keep the blood safe anymore. Now, there is also something called the Philadelphia chromosome, which occurs primarily in adults, but it can happen in kids sometimes. In this particular example, it's only Ben does not have this Philadelphia chromosome. He has precursor B-type leukemia, but the Philadelphia chromosome is where the 9th and 22nd chromosome exchange places and exchange a variety of genes. The overall nature of this is much more complicated, and there is precursor T-type acute lymphoblastic leukemia, but we're not going to get to that right now as this is not the type of cancer that Ben has. Now, back to our regularly scheduled program.
Doc, am I going to be okay?
Well, Mr. Weinstein, we did catch this fairly early, and while your test didn't look too good, there is a road to recovery. It will be very intensive, as chemotherapy normally is, but I have no doubt that you will enter remission within the next 2 to 3 years.
What about the cost?
Unfortunately, my explanation of all this, as well as the cost, is not covered by your insurance.
Oh no.
Yes. I normally don't make exceptions for dying children, but I think if we factor this as your make-a-wish, we might be able to find a result.
Yes!
Alright, so let's explain to you what's happening. Now, found deep in the mystical forests of your local florist shop, you can find the periwinkle. The periwinkle contains an alkavink known as vincristine. What does vincristine do exactly? It occurs in the induction phase of chemotherapy, and it isolates a protein found in your cells known as tubulin. What the heck does tubulin do, you ask? It results in rapid cell division as a result of metaphase. Excuse me, got something stuck in my throat there. What vincristine does is that it isolates this tubulin and stops the cells from dividing. The problem with this is it doesn't know to specifically target cancer cells and only targets all cells that have an immense amount of tubulin in them, but that could result in a busted hairline like this, or no hairline at all. Now, some other things that happen in the induction phase of chemotherapy are the administering of drugs such as dexamethasone, prednisone, and anti-inflammatory drugs. Those are also anti-inflammatory drugs, but there are other types of drugs that are administered. This could make your hand look like this, or Ben's head looks like this. That's what the drugs are for. There are also some anthracycline drugs which prevent DNA from replicating during the S phase of mitosis. Of cellular division. Now for consolidation. This is phase 2, and this is where you start to enter remission and a continuous stream of drugs are entered into the body. Something also known as a stem cell transplant can occur, where you take stem cells from one part of your body or from the body of another patient and you put it in a different part of the body in order to ensure maximum health in the infected area. Now finally, phase 3, maintenance. You have 6-mercaptopurine. It's a purine, by the way, guys, which is known for inducing apoptosis. The maintenance phase is to ensure that no remission occurs and is often the least strenuous phase of chemotherapy, but it does take around 3 years for full remission to be ensured. As I repeated prior, 6-mercaptopurine, also known as 6-MP, induces apoptosis within the cells and can result in some nasty side effects, such as heart palpitations, fatigue, nausea, and tiredness.
Any predictions for the success rate in children?
60%! 40%!
No, actually, that'd be incorrect. It's actually 90%.
Wow, it is?
Yeah.
Nice. Now for some
So,
questions.
questions for you guys?
Is it C? Dexamethasone?
No. The answers are going to be A, 6-mercaptopurine, C, 12 and 21, and B, complete blood count.
Thank you very much.
Thank you,
Mr.
guys.
Vaccine. We appreciate you all.